Let me talk specifically about universal access to health care. So next week, we have 45,000 people coming for the International AIDS Society meeting. There's been enormous investments in HIV. But if you go back and look at the stuff that I was saying in 2003 and 2002 when we first started seeing those investments, what I said over and over again is the investment in HIV is our opportunity to really invest in systems. The critical thing about investing in HIV treatment was that for the first time we invested in chronic treatment, lifelong treatment for a disease in the poorest countries in the world. That forces you to put systems together. So I think the debate, and I mean the discussion is moving in a great direction. What the HIV people are now saying is, well, what about MDGs 4 and 5? What about childhood mortality and maternal mortality? What are we going to do to tackle those particular problems? And I think the most important thing is related to what I said earlier. We have to understand this as a systems and delivery problem and not as a disease problem, right? The aspects of this problem that need to be handled by highly trained physicians are actually quite narrow. The real problems are setting up the delivery systems that can not only protect people from the diseases of today, but from the diseases of tomorrow. And there's enough money out there in the world that we can begin moving in that direction. That's how I would like to see the World Bank engage. We are really good at thinking about systems. We are really good at managing processes at country level. And we're also really good at thinking about how to set up systems that deliver. So wouldn't it be great if we could take all this investment in global health and in every single country build systems? At Partners in Health, the organization I worked with before, every country we've gone into, and Rwanda is a good example, we've gone in and said, we're going to take this money for HIV treatment and turn it into primary healthcare systems. And I think the evidence is overwhelming that it's both doable and cost effective. And the other thing that we've seen that we didn't expect was that once we've built those systems, the economy sprouted up around those healthcare systems and actually contributed to the economic growth of those countries. So one, health and education are critical to economic development in my view. I think the evidence is very good for that. But also, I think the bank has a very unique and wonderful contribution to make, which is to say, hey folks, these really aren't medical problems. They're partly medical problems, but the big chunk of it that we can help you with is what's going to give you the long-lasting impact, protect you from future disease outbreaks, and also help to build your economy.